This video is for informational and educational purposes only and is not a substitute for professional medical advice. Throat cancer is a serious condition that can affect anyone, but it's more common in men over 50. That's why it's crucial to recognize the signs and symptoms early to ensure timely diagnosis and treatment. Stay tuned to learn more about it. Hi everyone, welcome back to our channel. If you're new here, don't forget to subscribe and turn on notifications so you never miss important content. In today's video, we'll be covering the main warning signs of throat cancer to help raise awareness about the importance of early detection. Throughout the video, we'll explain each symptom in detail, providing examples and extra information to help you understand better. If you have any questions after watching, please consult a doctor for a personal evaluation. But first, let's take a look at what throat cancer is. Throat cancer, also known as oropharyngeal carcinoma, occurs in the area just behind the mouth called the oropharynx. This includes the base of the tongue, tonsils, soft palate, and the side and back walls of the throat. Signs of throat cancer: difficulty breathing, shortness of breath, whether mild or severe, that occurs at rest or during physical activity, can signal several respiratory conditions, such as asthma, bronchitis, or pneumonia. However, in rarer instances, it can also be a sign of lung or throat cancer, or an airway obstruction caused by a tumor. Risk factors include smoking, exposure to pollutants, and chronic lung diseases. If you experience persistent or severe shortness of breath, especially with other symptoms like chest pain, wheezing, or coughing up blood, seek immediate medical attention as it may indicate a serious health issue. Voice changes, such as persistent hoarseness, frequent throat clearing, or a weak voice, can be symptoms of various health issues, including throat cancer, particularly in smokers. It's important to distinguish between temporary hoarseness caused by a cold, flu, or overuse of the voice, and persistent changes that last more than 3 weeks. If your voice changes and doesn't improve, it's essential to see a doctor. The larynx, located in the throat, is responsible for producing sound. Changes in voice can be caused by laryngitis, inflammation of the larynx, infections, allergies, excessive voice use, or smoking. Benign or malignant tumors can also affect the vocal cords, leading to hoarseness and other symptoms. Neurological conditions, such as Parkinson's disease, can also impact the nerves that control the larynx and cause voice changes. Additionally, gastroesophageal reflux disease, GERD, which causes stomach acid to rise into the throat, can irritate the larynx and lead to hoarseness. If you experience persistent voice changes, especially with other symptoms like a cough, trouble breathing, or a sore throat, it's important to consult a doctor as soon as possible. Persistent bad breath, also known as halitosis, lasting more than 3 weeks and not improving with proper oral hygiene, mouthwashes, or chewing gum, can be a sign of various conditions. While it's often linked to poor oral hygiene or gum disease, halitosis can also be caused by digestive issues, dry mouth, xerostomia, diabetes, and in rarer cases, cancer of the mouth, throat, or tonsils. The main risk factors for persistent bad breath include smoking, excessive alcohol consumption, and poor oral care. Certain health conditions like diabetes, kidney disease, and liver problems can also contribute. If you have bad breath that lasts more than 3 weeks, especially if you also have other symptoms like a sore throat, difficulty swallowing, or bleeding gums, it's important to see a doctor for an accurate diagnosis and the right treatment. Lump in the neck. A lump in the neck, whether painful or painless, that may increase in size over time, can be a sign of an enlarged lymph node. This could be linked to various infections, autoimmune diseases, or, in rarer cases, throat cancer or other tumors in the head and neck region. Lymph nodes affected by cancer are typically larger than 1 centimeter, about 0.4 inches, in diameter. Enlarged lymph nodes in the neck can also be caused by viral or bacterial infections, like infectious mononucleosis or HIV/AIDS, and autoimmune diseases such as lupus and rheumatoid arthritis. If you notice a lump in your neck, whether it's painful or not, it's crucial to see a doctor for an accurate diagnosis. The doctor may order imaging tests, such as an ultrasound or biopsy, to determine the cause and begin appropriate treatment. Unexplained weight loss of 10 kilograms, about 22 pounds, or more over 6 months, despite following a regular diet and exercise routine, can be a red flag. This weight loss could be caused by a number of conditions, such as hyperthyroidism, diabetes, or depression, but in rarer cases, it may indicate throat cancer or other types of cancer. Other possible causes include changes in appetite, increased metabolism, digestive issues, or side effects of medication. If you notice significant weight loss with no apparent reason, see a doctor as soon as possible to determine the cause and receive proper treatment. Persistent sore throat. A sore throat that doesn't improve within a few days or lasts more than 3 weeks, even without other cold or flu symptoms, can be a concern. It's important to distinguish between a common sore throat, which usually resolves within a week, and a persistent sore throat that may be a sign of chronic inflammation in the throat. This could be related to factors like excessive alcohol use, smoking, or gastroesophageal reflux disease, GERD, and in rare cases, throat cancer. If you experience a sore throat that lasts more than 3 weeks, especially if it's accompanied by difficulty swallowing, hoarseness, or unexplained weight loss, seek medical attention promptly for an accurate diagnosis. Difficulty swallowing, dysphagia. Difficulty swallowing, or dysphagia, is when you feel discomfort or a sensation of something being stuck in your throat while eating or drinking. This could be caused by a tumor obstructing the throat, making swallowing difficult. Besides throat cancer, dysphagia can also be linked to conditions like GERD, hiatal hernias, neurological diseases, and muscle disorders of the throat or esophagus. If you experience persistent or severe difficulty swallowing, it's important to seek immediate medical attention, as it may indicate a serious issue that needs proper investigation and treatment. Persistent earache. A persistent earache or pain that radiates to the ear, throat, or mouth, lasting more than 3 weeks, can indicate tumors in the head and neck region, including nasal, oral, or laryngeal cancers. However, earaches can also be caused by conditions like ear infections, otitis media, temporomandibular joint (TMJ) problems, and eustachian tube disorders. If your earache persists for more than 3 weeks, especially if you also experience other symptoms like a sore throat, difficulty swallowing, or hearing loss, it's essential to see a doctor as soon as possible for an accurate diagnosis and appropriate treatment. Persistent cough. A dry or phlegmy cough that lasts more than 3 weeks without any clear cause should not be ignored. While persistent coughs can be linked to various respiratory conditions like bronchitis, asthma, or pneumonia, they can also be a sign of lung or throat cancer, especially in smokers. Other risk factors include exposure to environmental pollutants, a family history of cancer, and chronic lung diseases. If you have a persistent cough that lasts over 3 weeks, particularly if it's accompanied by symptoms such as blood in your sputum, shortness of breath, or chest pain, it's essential to see a doctor for an accurate diagnosis and appropriate treatment. Bleeding in the throat or mouth. Unexplained bleeding in the throat or mouth, especially if it occurs spontaneously or after coughing, spitting, or vomiting, can be a sign of conditions like mouth ulcers, gingivitis, or laryngitis. However, it could also be linked to cancer of the mouth, throat, or larynx. Smoking, excessive alcohol consumption, and poor oral hygiene increase the risk of developing mouth or throat bleeding related to cancer. If you experience bleeding in your throat or mouth, particularly if it's persistent or heavy, see a doctor immediately for an accurate diagnosis and treatment. If you're experiencing any of these signs, difficulty swallowing, feeling like food is stuck in your throat, frequent choking, voice changes, or other mentioned symptoms, consult a doctor as soon as possible, even if it's not listed here. Share this information with family and friends to help raise awareness about throat cancer. Don't forget to subscribe to our channel for more health and wellness content. Thank you for watching, and we'll see you in the next video.